Good afternoon. Let me be crystal clear with everyone. I, more than almost anyone, would love to say that Baltimore City is open and safe. But that simply is not what the data is telling us at this time. And Baltimore City will not be moving to phase 2 today. Since Friday, June the 5th, we have seen an 8% increase in confirmed COVID-19 cases here in Baltimore City. As of this morning, the city has 6,509 reported cases, 238 people hospitalized with COVID-19, and 284 deaths. I'm up here as much as possible to ensure our residents have the most up-to-date and accurate information, so they in turn can make smart and informed decisions for themselves and their families. We remain focused on continuing to scale up our response to this emergency to ensure residents of our city have the resources and support they need at this time, while continuing to leverage the wealth of medical and public health expertise here in Baltimore. I want to remind residents that they are encouraged to call their doctor or 211 for coronavirus symptom screening and to be connected to a physician for assessment. I also want to remind residents of the invaluable resources available at coronavirus.baltimorecity.gov. After consulting with our health commissioner and reviewing Baltimore City's health data on COVID-19, we feel comfortable making another modification today. Effective today at 5 p.m., non-essential retail businesses can reopen in Baltimore City with a maximum of 50% capacity. I want to thank all of our small businesses for their patience and their commitment to keeping our residents, their customers, healthy and safe. After extensive conversation with our public health professionals, I'm confident that this step is the right one based on the data and trend we are seeing in Baltimore City. Again, this is a low risk for public, but not without risk. I'll say it again. This is a low risk for public, but not without risk. As we still recommend social distancing, wearing of cloth face covering, staying home if ill, and hand washing. And again, I want to thank the majority of Baltimoreans who have heeded the warnings and followed the guidance. Before I bring up Commissioner DeRosa, I would like to address some of the rumors that have been brought to my attention about restaurants planning to reopen for indoor seating in opposition to our local emergency order. Again, let me be very, very clear. Restaurants are not allowed to open for indoor dining. The Baltimore City Police Department and the Social Club Task Force will be out tonight and throughout the weekend performing inspections of restaurants and businesses. And if we find that you have opened for indoor dining, you will be shut down. I will not put the residents of this city at unnecessary risk, nor will I open up restaurants for indoor dining if I don't feel it's safe for me or my family to be in one. The Health Commissioner and I want to review the data coming in from Memorial Day weekend and the protests to assess the impact on Baltimore City. We will review this data early next week and make an announcement about whether or not we're ready to move to phase 2 on Wednesday the 17th. Now I will ask our Commissioner, Letitia DeRosa, to update you on our COVID response and our work to support the residents of Baltimore City.
Thank you, Mayor Young, for your leadership during such difficult times. I also want to take time to really personally thank all of the businesses that have heeded the mayor's executive orders for these past few weeks. I recognize that in remaining closed, there have been major impacts on you and your family's financial well-being. In addition to the financial challenges that so many are facing, I know many are also missing a sense of normal life. I too miss that sense of normalcy we had before COVID-19. I miss going to the gym or hanging out with my friends and family. But by listening to the mayor's orders, you have helped keep many of our residents safe and alive, and for that, I can't thank you enough. When I took this job, I pledged to promote the health and well-being of all residents in our city. To do that, we've had to make some very hard decisions, and your sacrifices have contributed to the public health of all Baltimore City residents. You are truly heroes, and for that, on behalf of the city and the health department, I personally thank you. We have heard from our critics who have posed the question as to why Baltimore City is moving so slowly compared to the rest of the state in reopening. I would like to take some time today to talk about what goes into our decision-making so we can help the public understand that their health and well-being are at the forefront of all of the decisions we have made during this pandemic. As we indicated last week, there are 5 main data indicators that we're using to guide our reopening decisions. A sustained decrease in the average rate of new COVID-19 cases per day, a sustained decrease in the average number of new COVID-19 fatalities per day, an increase in the number of tests performed daily across the city, a decrease in our COVID-19 positivity rates, and a decrease or holding steady in our intensive and acute care hospital utilization rates. All of this information, including where Baltimore City stands, can be found publicly on our website at coronavirus.baltimorecity.gov. Additionally, you can see this dashboard to my left to know exactly where we are in meeting criteria for the next phase. As you can see, we are doing pretty well in some areas. Our positivity rates have gone down, and we're certainly seeing our hospital utilization rates hold relatively steady. However, we continue to see an average increase in the number of cases. Baltimore City still averages about 125 new cases of COVID-19 per day. Additionally, our COVID fatalities have held relatively steady. Looking at this next visual, it demonstrates where Baltimore is compared to other analogous cities. And as you can see, we have seen an almost 12% increase in our average number of case counts compared to the previous week, which is much higher than other large cities, including Philadelphia, DC, St. Louis, Detroit, and New Orleans. The health department reviews the metrics I just mentioned on a daily basis and examines it in more detail twice weekly with the mayor and his leadership team to inform guidance about moving between phases. The decision to move forward, pause, or move backward in the phases of reopening is a judgment call based on an overview of all of the key metrics. Ideally, we'd like to allow for at least 1 month from one phase to another to really study how reopening has affected the case data and hospital utilization rates. Only time tells whether a data point is trending positively or negatively, and a period of 1 to 2 weeks is generally not sufficient time to see the impacts of decisions made on reopening. So here's what we know. Our epidemiological data for Baltimore City has not shown a consistent decline in new cases. New fatalities due to COVID-19 have somewhat leveled off, but they are not consistently declining. Our positivity levels overall have been improving, but I would be remiss if I did not mention that this has not been consistent throughout every single zip code in Baltimore City. Some of our zip codes continue to see high test positivity rates well above the state and citywide average. This just highlights the medical disparities at the neighborhood level that we have always known existed, but that have been exacerbated by this pandemic. We also know that the risk factors for COVID-19 disease include pre-existing conditions such as diabetes, obesity, kidney disease, and heart disease. Baltimore City has more underlying chronic conditions at the population level than most other jurisdictions in Maryland, and in the midst of a pandemic, we must move cautiously and keep the health of our residents in mind. Baltimore City also houses 11 acute care hospitals, more than any other jurisdiction in the state. Our hospitals are often caring for residents outside of our jurisdiction, limiting their overall capacity for a surge in cases in Baltimore. Here is what we also know. We do not yet have testing capacity where everyone in Baltimore City can get a test when they want it. Long lines at our mobile clinic in Highlandtown, as was reported by several news outlets earlier this week, are testament to that. While we are working right now to provide low-barrier, appointment-free mobile testing sites, it takes time, staff, and resources to do so safely. Baltimore City needs to continue to expand its testing capacity, and specifically all of the necessary support staff to follow the state in reopening at the same pace they are setting. What we also know is there is a potential for recent protests to cause a spike in cases in the coming week or two. I understand why people are protesting. We have been made to feel as if our lives don't matter. As a public health official, I applaud the activism and expression of our First Amendment rights as thousands participated in peaceful marches and protests across Baltimore City. The dismantling of systemic racism can and should be viewed as a public health crisis that only through activism can we as a country overcome. We also must acknowledge that this period of activism and social movement is occurring in the midst of a pandemic. As such, we should be cautious when viewing data that could quickly change as a result of protests. In the same vein, if there was a spike of new COVID-19 cases because people had cookouts on Memorial Day with their extended family and friends, or drove to Ocean City and went to the beach without following social distancing guidance, we would also expect to see a spike in the next few days. And so knowing this, we will wait until next week to announce any further reopenings out of an abundance of caution to ensure that we're making the best possible decisions about reopening based on the most up-to-date data. I want to be very clear in my message to city residents as we see the reopening of businesses in Baltimore City as well as across the state. Coronavirus has not gone anywhere. Instead of relaxing, the reopening of businesses should raise everyone's levels of vigilance. Businesses should make every effort to keep their employees and their customers safe. This includes having a plan for how to minimize the number of people in your establishment per guidelines set forth, creating protocols for screening employees for illness prior to them coming into work, and having sick leave policies that allow for workers who are ill to stay home without the risk of losing their job. This means instituting appropriate safeguards and disinfecting practices in your establishment, as outlined by the CDC, OSHA, and the Maryland Department of Health, in an effort to protect your staff and your customers. It means enforcing hand hygiene, social distancing, and the wearing of face cloth coverings for everyone in your establishment at all times. As we safely move to reopen businesses and resume normal activities, we will have to adjust our actions and interactions with one another accordingly. But if I know anything about Baltimore, it's that we are tough and resilient. We are our brothers and our sisters' keeper, and we all have a significant role to play in the spread of coronavirus. We all must remain steadfast in our mission to protect the health of those that are most vulnerable among us. Thank you.